1st, 2020 morning meeting. I'm going to read in some instructions for those that might want to speak here. To the public that's watching this meeting, when you registered for the meeting, you were registered in our system as attendees. Attendees are webinar participants who are viewers of the meeting and audience member. Your microphone and your webcam are automatically muted as attendees. However, there will be a time in the meeting that we will be opening up for public comment. When that time comes, if you wish to speak, we'll ask you to raise your virtual hand. You should see a hand icon on your device. Simply press it once. When public comment begins, our moderator will call names. When your name is called, you'll be unmuted and given 3 minutes for public comment. When your 3 minutes is up, you'll be going back into muted status and you can continue to watch the webinar as long as you'd like. We'll try to give everyone who wishes to present public comment an opportunity to speak, but please note, if there is an event where there are more people wishing to speak than the time allots, I may need to limit the number of speakers and or reduce the time allotted to each speaker or pick speakers randomly. We haven't had to do that, and hopefully we'll continue on that rate. So at this time, we'll move into our regular agenda. Are there any adjustments to the agenda from anyone? Okay, I don't see any or hear any. Is there any emergency business for us today? Okay, I don't see any there. So we will move straight into public comments, and I'll transfer this to our moderator.
Thank you, Chair Buck. At this time, I would like to ask anyone who is an attendee of the meeting that would like to present public comment to raise your virtual hand. When I see your hand go up, I will call upon you. I will unmute your microphone and I will start the timer and you may begin your public testimony. At this time, I do see Nicole DeGraff has her hand raised. Nicole, I will unmute your microphone and I will start the timer. Nicole, it looks like you are self-muted. There you go. You may begin your public comment.
Hi, can you hear me? Yes, my name is Nicole DeGraff. I had a rather lengthy letter that I had sent in, so I would direct you to most of that because I couldn't possibly speak about that in 3 minutes. So bear with me. I'm just trying to read off of what I wrote, some of the things I felt were important. I'm a mother of 3. I've been involved in community. I'm very concerned about extending the emergency declaration again. So I'm requesting that you do not extend the emergency declaration. In March, when you passed the emergency declaration, Lane County needed a state of emergency for COVID-19 because the virus was unfamiliar and we thought our health system was unprepared. Lane County is now amply prepared. It's time to end the declaration. Per the Lane County Home Rule Charter, ordinances must be announced twice, 13 days apart, and I haven't found evidence this was done on the original or subsequent extensions of the emergency declarations. In 2018, 243 residents died from flu or pneumonia, which is astronomically more than COVID deaths in Lane County and did not warrant an emergency declaration. The hospitalized rate is 0.07%. Deaths are 0.16 of 100,000. Only 6 people have ever needed to be placed on a ventilator. We have sufficient PPE testing and tracing. Our positivity rate has been 0 to 2%. The hospitals have never been overwhelmed. There are currently 2 hospitalized and only 48 ever have been. Cases are irrelevant as they do not mean infected. There are 15 zip codes in Lane County that have never had a single COVID infection. I've listened to countless updates by Lane County Public Health and nothing in their updates warrants an extension of emergency declaration. Whereas we have ample resources for any significant expenditures of resources at the local level for response in order to keep the public informed and safe. You've authorized extensive amounts, $10,750,000, not including the $7.5 million in CARES Act funds given, including $930,000 in rental assistance, as well as the $1.8 million building at River Avenue you've bought. I haven't seen an update per the ordinance as to where those funds have been allocated or spent. Schools are carefully reopening. 21 are reopening in person to K3, and that so it doesn't warrant another extension. The case rate is 100,000 The case rate per 100,000 is 8, which is under the metric for reopening schools. And please stop me if I go past 3 minutes because I don't know how long this takes. Per Lane County Code, a state of emergency can only be called if the threat overwhelms the current resources of the state. To extend the emergency declaration would make each of you voting yes to extend complicit in fraud by intentionally misrepresenting the information about the local health emergency for monetary gains. In other words, you're allowing this local health emergency or disaster, as it were, to stand in order to get state and federal funds, which is fraud and a felony and carries a prison sentence. You've already extended in May and July.
Nicole, your timer
Okay.
has reached the 3 minutes. Thank you
All
for
right.
your public comment. Thank you. At this point, I do not see that anyone else has their hands raised to speak. I do see one other person is on the line. If you would like to speak, please raise your virtual hand. Chair Buck, I do not see anyone else wishing to give public comment, so I will turn this back over to you.
Okay, thank you. And thank you, Nicole, for speaking. Is there any response or remonstrance from commissioners this morning? Okay, I don't see any. So, Commissioner Bozovich.
Thank you. I just wanted to take a moment to thank the firefighters and first responders, our staff from Public Works and other cooperating agencies for the work they did both Friday evening in stopping the 4 fires in the Veneta area, and then the work they've done on the Mapleton fire, the Sweet Creek fire, and keeping that as small as it was, and generally gaining some really good control over it in the last couple of days. I got to attend the brief-in for the team that came in to take over the fire from ODF, and I saw vehicles from Scappoose. I met folks that were from Josephine County. We're just very thankful to have this assistance from across the state to control that fire. It is, in a dangerous spot. If it were to spot fire around that area, there's a fair amount of rural residential interface on the other side of the highway and on the other side of the river from this area. And it's bad enough that it's also in an area that there's several cattle ranches and a few other productive parts of Lane County, and it's just kind of terrible that we're losing valuable timber to this fire that it doesn't seem to have any other cause than human cause. There was no lightning in the area at that time, and it's just really sad to see human caused fire cause such destruction. But I just wanted to take a moment to thank the folks from ODF, all the other cooperating agencies and first responders, including our Public Works Department, which is helping to keep the road clear, as most of this fire is uphill from Sweet Creek Road. And Sweet Creek is the access to fight the fire. Everything's rolling down the hill into Sweet Creek Road. And our Public Works staff is actually there helping with some of that work. So, and I know our Sheriff's Department is helping to keep the river clear for the helicopters that are dipping. So just thank you to everyone that's helped in responding to that fire.
Thank you. Any other remonstrance or response? All right, I don't see any, so I will move into item number 5, County Administration, and this is our COVID response and recovery. With us is Steve Mokrahysky, our County Administrator, and Karen Gaffney, our Director of Health and Human Services.
Thank you, Chair and Commissioners. I'll be pinch hitting today for Karen, who is out. And so I want to first just offer, as the board knows, but to any public who are tuning in that may not be aware, we have our Lane County COVID-19 response plan that's located on our website. And within that plan includes a one-page overview of these 5 priorities that we've identified for COVID-19 response in Lane County. And I'm going to walk through an update on each of these. contain the spread of the disease, ensuring that healthcare providers, first responders, hospitals have what they need, minimizing economic impacts on businesses and individuals, providing public information and guidance, and preparing for the fall and winter. So I'll walk through an update for you on each of those. I will say that the person who provided public comment did a really nice job of giving you a brief overview of some of the things that I'll touch on in terms of case rate and testing and positivity, test positivity and hospitalizations and those types of things. So the data was generally accurate. I will say, as it relates to the emergency declaration, I just want to offer that I think there's a misconception about what, and we've talked about this in the past, what the emergency declaration by the Board of Commissioners does. And so I just want to clarify, I think as the board understands, but for everyone, that the emergency declaration in Lane County really provides authorization to the county administrator and to our staff to be able to leverage resources that are available to respond to the needs in the community. We then provide regular updates and we come back for reauthorization of the board to that. It also does send a message to the state and federal government that we continue to deal with an emergency here in Lane County. And I think, as you'll see, the numbers have continued to trended positive in compared to the state and national numbers in Lane County, but we have more recently seen a slight increase in numbers. And so our public health officials and all of us here in Lane County believe that we are still on the front lines of dealing with this global pandemic. So yesterday, public health reported 18 new COVID-19 cases that were tied to a long-term care facility. There were over 20 new cases through the weekend, and 18 of those are tied to a long-term care facility. That's obviously concerning to us because of the high risk of individuals at the care facility. I believe 12 of those 18 individuals were residents at the care facility and 6 are staff. Public Health, Lane County Public Health is working with the representatives of that facility to implement public health best practices. Test positivity rates last reported by the Oregon Health Authority for the week of August 16th in Lane County were 1.1%, and for Oregon 5.1%. Lane County measured the same as last week, and Oregon decreased by 0.3% from last week. The case rate per 100,000 last reported by OHA for the week of August 16th in Lane County was 8, and in Oregon was 40. And that was, Lane County decreased by 2 from the prior week, and Oregon decreased by 8 from the prior week. So that is a positive trend. Lane County is meeting all of its public health indicators. And these are the indicators that inform the Oregon Health Authority regarding the county's opening status. As the board and public knows, we're in phase 2 of the statewide opening. OHA reports that as of August 26, Lane County followed up on 100% of cases in terms of contact tracing in the last 7 days within 24 hours. The state target to meet is 95+%, and so we're meeting this metric. OHA reports as of August 26, Lane County has 17% of cases that are not traced to a known source in the last 7 days, and 30% or less is the target. And so Lane County is meeting that target. It's also a decrease from the prior week, which was 28%. We're at 17% for the last week. We have 96 active persons under monitoring. Last week, we had 25 part-time contact tracers working, including University of Oregon students and Lane County Public Health staff, not including lead support staff. These individuals, these contact tracers, call all of our persons under monitoring daily. Tracers reach about 76% of persons under monitoring each day. The number of contacts has been decreasing. However, contact tracing teams remain prepared in case of an increase in contacts. We have 3 patients at the River Avenue facility there, and I will say that while that number has remained relatively low, it is critical that we have access to that facility for a house population that tests positive for the virus, but are not in need of hospitalization for quarantine and isolation purposes. There are 13 households that have been provided with active case management in closed cases for 186 households. We have a strong partnership with Whitebird and good community partnerships in South Lane to support households in isolation and quarantine. We're obtaining housing stability information on households under active case management. In terms of testing capacity, almost 54,000 tests have been conducted in Lane County. As of the board briefing last week, there were approximately 50,000 tests, so 4,000 additional in the past week. As of August 22nd, Oregon's cumulative positivity rate is 4.5% of people tested. This is considerably lower than the national average of 9%. Of the 24,177 people tested the week of August 16th to 22nd, 1,233 or 5.1% were positive. This is the statewide metric. The total for that week is likely to rise as test results continue to be reported to OHA. It is reassuring that test positivity is relatively stable, which suggests that the number of people newly infected with COVID-19 each week is no longer increasing rapidly. Testing supply allocations for manufacturers have been stressed nationally due to increased demand for testing and increased cases of COVID-19. Laboratories are reporting that allocations for most COVID-19 test manufacturers cannot keep up with the demand and are consequently sending specimens to outside labs for testing. This obviously causes some delays in reporting. Approximately 20% of specimens in Oregon were sent out of state for testing last week due to these constraints. The Reservoir Sentinel testing team will finalize hiring and onboarding this week. We don't have any events scheduled for September at this time. Lane County PPE, so in terms of personal protective equipment and ensuring that healthcare, we're now on priority number 2, ensuring healthcare providers, first responders, hospitals have what they need. Lane County PPE inventory is in good shape. We're meeting all metrics and needs with our current inventory. The supply chain is still trying to catch up with demand. The fire season, as you can imagine, has slowed down mass delivery, and gloves continue to be the biggest concern at this time. Lane County recently responded to with a large order for a facility with an outbreak. Lane County continues to monitor PPE and hospital capacity through the Oregon Health Authority's HOSCAP database. Local resources and capacity remain adequate to current and expected surge levels, and COVID-19 related hospitalizations in Lane County remain very low. I believe we're at 3 hospitalizations currently. Let's see, moving on to minimizing economic impacts on businesses and individuals. This is priority number 3. As of 9 a.m. on August 24th, Lane County Human Services had served 552 households with nearly $1.4 million in CARES Act COVID-19 rental assistance, and 1,205 households with 512,000 CARES COVID-19 energy assistance. So that's really positive work by our Lane County Human Services team to assist households in need in Lane County. Last month, the board had asked us to provide information on how much federal resources have reached businesses in Lane County through the PPP program. This was business assistance through loans. And an updated PPP data shows that, I believe we provided an update to the board last week, that there were around 4,000 businesses. We have updated data that shows that 4,886 businesses in Lane County received PPP loans. The SBA reports the PPP data They report it in two different categories: loans less than 150 and loans greater than 150. So that breakdown is of the 4,886 businesses, 4,084 of those businesses receive PPP loans less than 150,000 for a combined total of approximately $156 million. And 802 businesses, the balance of that number, receive PPP loans of more than $150,000 for a combined total of between 303 million and 736 million. So that's a big range, but it gives you at least an idea on scale of the hundreds of millions of dollars in federal funding that has supported our local businesses. So again, this data is only available as approximate ranges. We can't get the exact number. I will also say that as of our last reporting, the average loan amount, I'm not going to report that number because I think that's outdated, but the 83% of recipients are located in the Eugene Springfield area. So on priority number 4, public information, providing public information and guidance. Call themes for the August 24th to present report period are testing, questions about quarantine, mask usage and enforcement, exposures, questions and concerns about travel, business complaints, and outdoor events. On August 29th, we had, because we're not open on Saturday, the call center is not open Saturday and Sunday, we missed 9 calls on Saturday and missed 5 on Sunday. Social media hits, and of course, if we have messages that are left, then we return those. The Joint Information Center will be prioritizing urgent messaging around local wildfire updates and evacuation. So you can imagine that our emergency operations team is stressed right now. Our public information officer, Devin Ashbridge, and our emergency manager, Patience Winningham, who are typically supporting our COVID-19 emergency response, are currently helping to support fires in West Lane County. And so we're dealing with multiple emergencies at one time, and I just want to offer the great appreciation for all of our staff that are assisting in these efforts. And finally, on preparing for fall and winter, we've talked about the 3 areas that we're working with: K-12, higher ed, and the unhoused community to prepare for fall and winter. As of midday on August 31st, at least 91 blueprints have been submitted from 4J, I should say an additional 1 since last week. So 91 blueprints for school reopening of K-12 have been submitted. Eugene 4J submitted a district-wide plan on August 31st, and we're currently reviewing that. Schools starting in CDL are not required to submit a plan to Lane County Public Health at this time. Schools' plans are continuously changing, and of course we know that every school is handling this in different ways. And so we're working to support and ensure that schools are following the state guidance that has been provided. Many schools are preparing for reopening in person later this fall and winter and submitting those plans for our review. At least 21 schools plan to bring in grades K to 3rd grade under the county exemption allowance. So again, 21 schools in Lane County that we know of are planning to bring in kindergarten through 3rd grade under the county exemption allowance. I think as the board understands, and to make it clear with the public, that there are certain metrics that have to be met. The county must have less than 30 cases per 100,000. In Lane County needs to is 10 cases, less than 10 cases per 100,000. So for us, it's less than 30 cases per 100,000 in the preceding 7 days for 3 weeks. And I'm sorry, I think I've stated that wrong. It is 10, it's less than 10 per 100,000 in Lane County for the preceding 7 days for 3 weeks in a row, and have county test positivity rate of less than or equal to 5%. So we obviously meet the test positivity requirement at just about 1%. And we're right at the 10, less than 10 per 100,000. There's also a requirement that we meet the state requirement for 10 per 100,000 be met, and the state has been, I'm sorry, that's test positivity. So test positivity needs to be at 5%, and that number has been trending down, is now at 5.1%. At least 35 blueprints have been reviewed. Schools have sent feedback letters. Anything needing immediate attention, clarification, or technical assistance gets a follow-up phone call. And we continue to have regular calls with K to 12 schools and support their needs in any way possible. Of course, as the board knows, we're working closely with the University of Oregon officials, and last week they announced their reopening plans. And in it, President Schill indicated the close work that the university is doing both with the Oregon Health Authority and Lane County Public Health, and continue to seek our guidance and interpretation of rules and language there. So working with the University of Oregon as well as other higher education institutions in Lane County. And then finally, in terms of our work on the unhoused population, we continue to work with the City of Eugene and City of Springfield and our rural partners. We had a call yesterday with our regional managers, city managers throughout Lane County. In part talked about COVID update, including support for the unhoused communities. Sarai Johnson, our joint shelter and housing strategist, is working actively with our partners in the community to identify scattered site solutions. I also had a call yesterday with Sarai and representatives from Carry It Forward, which is a small nonprofit that Lane County provided financial support for in the past year, doing great work employing homeless individuals to provide services on the street, services to other unhoused individuals, and then get those folks moving on to future employment. It was great to hear a number of new programs that Carry It Forward is working with Shelter Care, with Peace Health, with Pacific Source. They're talking about opening a 12-bed shelter and navigation center, a micro navigation center at the edge of Eugene with Shelter Care. So there are a number of these examples that we're working on with nonprofit organizations, and we'll continue to report on that to you. So that's the update that I have. Thank you for bearing with me in that lengthy overview, and certainly happy to entertain questions you may have, and I'll do my best to answer those. And if we don't have an answer, we'll get one back to you as soon as possible.
Commissioner Sorensen.
Thanks very much for the report. I just wanted to ask a kind of complicated question about testing and my continuing concern that we're not doing enough testing. And that relates to two components of your report. One is the statement that Mr. Davis made to the media that there was no one to blame for the outbreak at a nursing home facility, where apparently because of the close contact and no prior cases, he said there was no one to blame for the outbreak. And yet I understand that, and you need to clarify this so it's clear to the public, but I understand the University of Oregon is going to be involved in mass testing of students who come back for the university, and the testing has occurred at other large universities where they've brought students back. And I'm wondering why we can't get mass testing at least the nursing homes and other close congregate settings where we've had outbreaks. And could you explain also why we would use the term "there was no one to blame"? Why would Lane County say that when, at least in my view, the facility is to blame because they didn't test their residents? I don't understand why we would say that there was no one to blame. So can you talk a little bit about both the testing at the university, why they're getting all these tests apparently, and why we're not requiring, or why nursing homes aren't testing people?
Thank you, Commissioner. I don't have an update on the University of Oregon's rapid saliva test that I think you're referring to, that would allow them to do mass testing of students. And I should say that that increased capacity, once it's available, will be available both to the University of Oregon, and some portion of those significant number of tests will be available to Lane County Public Health to do additional testing, primarily surveillance testing. And so when you talk about targeted areas, we continue to have surveillance testing that is conducted regularly. So these are the testing events that Lane County coordinates, as opposed to the responsive testing that individuals will go to a clinic or a private lab or the hospital and get a test because they believe they've been exposed, or they have symptoms. The surveillance testing is what Lane County is doing, the proactive front-end testing to go out into populations that are at risk in various parts of the community, identify where the virus is that we don't know yet, and then to do our tracing and isolation approaches. And so we have been and continue to do surveillance testing of long-term care facilities. I think it's important to know, when you test once, you're testing at that point in time. And so it doesn't provide you assurance indefinitely, forever, that there will not be positives there. I can't answer to the comment about blame. I didn't see that comment, but I will just say, I presume that Mr. Davis said that because there isn't anyone to blame, and I don't think that we're looking to blame anyone. So I'll certainly follow up on that specific outbreak at the long-term care facility, and how that was identified, and whether or not there were processes and protocols or additional testing that should have been conducted that were not. I'm not aware of that. And then again, I will just say on the University of Oregon rapid testing, I don't have an update right now, but I'm not aware that that testing has received its final approvals through the FDA and is ready to hit the street. We are anxiously awaiting that. And again, that will allow both the university as well as Lane County to conduct additional testing in the community.
Well, thanks for looking into that. And yes, I agree that one of the facets of my inquiry is in the past about why Lane County would say no one's to blame, when I think at least reasonable people could differ on whether or not someone is to blame. Apparently they never tested any of the residents, and they never tested any of the workers, both of which had COVID ultimately. But I think the better inquiry is not really what happened in the past, i.e. yesterday or before, but rather what can we learn about this? And if we are seeing the university students, and many of them are from wealthier backgrounds, and I know that by watching the basketball, professional basketball, that the NBA players are tested on a regular basis. Why aren't we getting these lower cost tests in places where we have the congregate settings, either workplace, such as a seafood plant in Newport, or a meat packing plant in Kansas, or a jail or prison or a nursing home, where there's people in very close proximity to each other. And it seems to me that has got to be one of the areas in which we put these lower cost saliva tests or other kinds of testing into place on at least a more regular basis. Maybe we can't afford to test everybody every day, but maybe all the people working with those people in nursing homes should be tested, or maybe, and I'll leave it up to the public health people, but I just see a failure of testing as being a component of why this many people got sick so rapidly.
Well, and I would just offer, an additional response that you're right in the sense that as we reported here, and we report, I think, each week about we have a national shortage of testing. That has been the problem. One of the primary challenges nationwide since this pandemic started is that we don't have adequate testing on the national level. Once the rapid saliva test is available through the University of Oregon, we will have increased capacity, and there will be a significant increase in the number and speed in which we can test, and so and we will put that to use in the higher risk portions of the community, including long-term care facilities. But testing continues to be a national challenge. So we're doing. I guess I would say it. I think we're doing the best that we can do with the availability of tests that we have access to.
Thank you.
Any other comments or questions? Commissioner Berney.
Thank you. My questions, Steve, sort of relate to a smorgasbord of fronts, but I'll try and focus and be articulate. Having read the person, Ms. DeGraff, that gave public input, and read her earlier letter, which was actually what I looked at, was addressed to the superintendent of the Springfield School District. I just want to clarify, and give me a yes or no. I want to make sure I understand the right things, but the county's extending the emergency declaration in no way has any impact on what schools plan to do, when they plan to open. We have no authority over that. Is that correct?
That's correct.
And my understanding also is that our extending our emergency declaration has in no way any impact on closing or opening businesses, on telling businesses what they can or can't do. That's not what the county is at all doing by extending that. Is that not correct?
Correct.
Okay, thank you, because that alleviates some misunderstandings that I've been the recipient of. I understand the frustration out there, but this isn't a soapbox to articulate that. I think we're all incredibly stressed and incredibly frustrated, and we're experiencing with our grandchildren the same issues of what do working parents do. I'm sure maybe one of our commissioners is too. What do working parents do when school is closed if their children have learning disabilities or socialization things? None of that, in my understanding, relates to extending this. This relates to our ability to draw upon resources which are dedicated to Lane County as it relates to assisting businesses, assisting people pay their rent, assisting people pay utility bills, and continue to monitor and manage COVID. Is that correct?
Yeah.
Thanks. Those were the shortest answers you've ever given me.
I mean, I can elaborate if you want, but
no, thank you. I appreciate it.
I don't want to take the, yeah.
No. So here's the only other thing, and thank you, because that's a huge clarification. I asked, and I appreciated the information on the dollars that were coming to businesses in Lane County that could both keep them open, keep some people employed, and keep dollars circulating through our economy during this terrible economic crisis. It seemed that based on the numbers you gave, Steve, the federal agencies giving out those numbers are very sloppy, because the difference between a total of $459 million, which integrated the low end of the 802 businesses that were provided over $150,000 and the 892 million. I mean, we either have about $500 million or $1 billion moving through the economy. Do we have specificity on which companies got how much? Not to be a big brother nanny state, but just to understand where the dollars are going? Or are we not given that information?
I don't believe we know the exact number that went to individual businesses. That's the reason we need to provide a range.
Got it.
Right. The range for the 802 over 150,000 was 300 to 700 million. That's a big range.
Huge.
Because we don't know. Yeah.
Yeah.
In terms of, I can inquire as to if we know if there's a list of businesses that received the PPP broken out in the way that I broke it out, more or less than 150,000. If you'd like that, I'm not aware that we can get that, but we can ask.
Oh yeah, don't do more than ask. I understand staff is stretched. A point I'm making that I want to make is that this body of commissioners and many people in our community are doing everything we can to generate whatever resource we can. Commissioners Buck and Bozovich have talked in other meetings articulately about the fact that we're kind of not getting our fair share of federal money. And when you look at the distribution of the CARES dollars to businesses, we have on the one extreme airlines that have received over $60 billion, Wall Street, versus Main Street, small businesses we care about in the county. And I would argue that they are also not getting their fair share as we move forward. But thank you for the clarification, and thank you for the report, and thank you for the time, Chair.
Just one update. Austin Ramirez, our economic development manager, our staff is so great because they watch these and then they send me text messages to help answer questions that I don't have answers to. So Austin shared that they don't list the businesses that receive loans over 150,000, but they do list individual businesses for those that received under 150,000. That was 4,084 businesses. So if you'd like that list, we'll cut down a tree and print it for you.
Our timber patrons will be oh so happy. Thank you very much.
Any other questions or comments? Far.
Thank you, Chair Buck. Ms. Mokrycki, thank you for the presentation. You kind of reiterated some of the things that you've already sent out in messages, and Commissioner Bernie, thank you for your questions, which actually your questions contain the answers. Even though Steve's answer was short, you elaborated during the question, so thank you for that. Steve, I just wanted to say that one thing that I love doing, and I think you recognize this, I love catching people doing things right. Not everybody loves to catch people doing things right, but when I do, I like to bring it out as soon as I possibly can. And I want to mention just something that you said about carry it forward. It was your foresight in the beginning that helped them establish a presence on county property in West Eugene. With that presence, they're able to not only employ, but utilize to a great extent people who have been living in homeless conditions. Because of that, you mentioned the partnerships that Carry It Forward is taking from the coordination that you provided, Ms. Mokrycki, with both Shelter Care, with Whitebird, and with others to reach out with a very, very small amount of money and resources to a great many people. So, Mr. Mokrycki, I caught you doing something right. You have been giving Carry It Forward a great deal of support, and in turn, they've been returning your investment with many times over. So really, I drive by our facility, Lane County Property, regularly, where Carry It Forward is located. The neighbors appreciate their presence, including our neighbor who is operating the truck transfer company on the very same side, and really they're a positive influence in the neighborhood. So thank you, Mr. Mokrycki, for that. And I also wanted to mention that we are dealing with multiple emergencies at one time. Your staff is just doing an outstanding job. I received the updates regarding the coordinated effort that Commissioner Bozovich talked about earlier regarding the fires surrounding Mapleton. And not only that, but other emergencies throughout the county. So, Ms. Mokrycki, I'm catching you doing things right. You're doing a good job. And while we can always point out things that we all can do better, by and large, the leveraging of county efforts is really outstanding, and is demonstrated by the numbers that as we compare to other counties in Oregon, and as Oregon compares to other states in the nation. So thank you for that.
Any other comments? All right, I just want to extend my gratitude to the Emergency Management Division. I know that they anticipated both dual emergencies occurring this summer at some time. I think we were actually quite lucky that we haven't had them earlier than we have. And they're doing an excellent job, and they don't have a lot of people in that department, but I'm glad we have them, and I'm glad it was set up the way it was set up years ago in order to facilitate having such quality folks working on our dual emergencies at the moment. With that, we'll move to the consent calendar. Is there a motion to approve?
Moved. So moved.
Second.
Moved by Commissioner Berney, second by Commissioner Bozievich. Any discussion? Seeing none, I'll call for the vote. All those in favor, please say aye.
Aye.
All those opposed, say nay. Motion passes unanimously. We'll move on to item 7A, which is County Council announcements.
I have no announcements, Chair Buck.
Okay, we'll move on to County Administration announcements.
I'm happy to wait, Chair, until after the next couple items, if you'd like.
Sure, we can put the announcements after the next two items. So we'll go to item 8B, which is order 20-09-01-03 in the matter of extending the declaration of a local emergency as a result of a public health response to COVID-19. And I believe we have you, Mr. Mokrzycki, and Patience Winningham, our emergency program manager.
And I'm not sure if I know Steve Dingle's here, and Steve's going to walk through some of this. I wanted to just offer Diana Jones, who is our behind the scenes board coordinator, facilitating all of this, also texted me just as a reminder that the emergency declaration is not an ordinance. And so the 13-day requirement does not apply. That was something that the person under public comment had referenced. And so I just wanted to point that out. This is not it is not an ordinance. And again, the questions that Commissioner Berney asked or statements that he made were all correct related to what this emergency declaration actually does and what it does not do. There actually are many more things it does not do than it does. It's very limited in scope. It does not impact schools. Actually, Lane County has no authority to determine whether schools open, close, do remote learning, in-person learning. We do review their plans and we provide guidance and advice and support, but we don't approve or deny those, as is the case with the University of Oregon and others. So I think I'd like to ask Mr. Dingle to just walk through the emergency declaration. And I'm not sure if Patience is here. It'd be great to hear from her, but I know that she's out on the front lines coordinating our response with other partners to the wildland fires that are happening. So Patience or Steve?
Yeah, Chair Buck and Board of Commissioners, this is Steve Dingle. Patience called me last night and asked me to step in with Steve on this item because she was tied up with the fires. So I don't really have anything to add because I think between the conversation and responses by Mr. Mokrzycki to the public comment, I think it's been covered. He mentioned in his update the only supply issue at this point, and I believe Ms. Winningham described it as a hiccup in the supply chain, has to do with gloves. And I think there's been a good job of this is not an ordinance, it's an extension, and it really is for the reasons that Mr. Mokrzycki stated. There is still not a vaccine. If this is not extended indefinitely, you'll see that it has an end date that was selected on purpose because of, again, we don't know for sure, but at least there's been a lot of conversation about a potential vaccine in December. So really, I don't have anything else to add unless the court has or unless the board has a specific question, again, I think a lot of the issues surrounding this have been covered in the previous conversations this morning.
Commissioner Farr.
Thank you. I just have kind of a strange question. I wrote down a quote this morning from Ms. DeGraff, who has, I count 7 letters that she sent to us already at this point. Her quote is, "You're allowing the disaster to stand in order to get state and federal funds, which is fraud and warrants a prison sentence." Council, can you comment on that?
Chair Buck, Commissioner Farr, I don't think that there's any basis for that. I mean, there is a national declaration of a state of emergency related to the pandemic. There's a state declaration of emergency related to the pandemic. This is not something that's cut out of whole cloth. There are counties all across the country that are doing the same thing. This is no different than, or at least analogous to situations where we declare an emergency to be able to assure eligibility for FEMA funds, for example, with snowstorms, ice storms, flooding, those sorts of things.
Thank you, Mr. Dingell. That satisfies my question.
Any other comments or questions? Commissioner Bozievich.
Thank you. So Oregon has averaged somewhere between 8 and 12 motor vehicle deaths per 100,000 over the last several years. We have had 6 deaths from COVID in Lane County in the last 6 months, which is about 3.2 deaths per 100,000 annualized. We haven't declared a state of emergency for motor vehicle accidents, and we all still drive. So I do understand the frustration of the public about the continuing state of emergency. So I do have some questions about this. And frankly, I don't care what the state, federal government, and other counties have done. I only control what Lane County's declaration is as a board member. So I want to understand why we need to extend this declaration a little bit better. And when will we be done? What is the definition of the terms when we can lift the emergency declaration? No one has defined that for me. And it's really difficult to continually extend an emergency when no one's defined endgame. You know, we've had vaccines for polio for a long time, and think about how long it's taken us to eradicate it, and it keeps popping back up worldwide. You know, we don't even have a vaccine yet for COVID-19. So, you know, what does the end game look like? So I'll start with this particular question. What does the declaration allow Lane County to do that we could not do if we didn't have it in place? I mean, does it change the fact that we can't have an emergency operations center running? Does it change the fact, is there something that we need to be doing that we can only do under an emergency declaration?
Steve, maybe I'll take a stab at that, and then you might be able to provide some additional comments. Chair and Commissioner Bozievich, I appreciate your comment, and I think that as we heard in the public testimony, and I think as many people feel in our community, our numbers have remained, you know, to date, relatively low. We've beaten the average on the state level and certainly on the national level. There still is a significant risk. And so part of the, I would argue that it's not luck that our numbers have trended positive for the past 7 months. We got on this early. We've been coordinated and diligent in our efforts. We provided really good public information from the start. The public and our businesses have responded and have done what they needed to do. So if you look at every step of the way where we've had large spikes or some spikes in numbers back in May and June, when we saw high school and college age house parties, we got out and messaged that, and it was driving an increase in numbers. We messaged that with the public, and we saw a response that parents and young adults got more serious. And those numbers then.
I can interrupt, Mr. Mokrzycki, is there an emergency declaration necessary to continue the work that we've done to hold down the numbers?
So I would say what the emergency
And
your question is, when is it going to end? I don't have a crystal ball, so I can't tell you that. What I can tell you is that when we have a vaccine and treatments, then that will significantly change the situation. The reality is that we've spent millions of dollars and a significant amount of time supporting K-12, higher ed, the unhoused population, and the general public in order for our numbers to remain low. So if you don't approve the declaration and we don't have an emergency declaration, it will provide less flexibility to the county administrator to be able to spend the resources necessary on things like acquiring facilities, and contracting with those that are necessary to provide services in the community, and it will hamper our ability to pursue both state and federal funds. We know that the state received $1.6 billion from the CARES Act. They allocated $300 million of it to the metro area in Portland, and the other $1.3 million they've sat on, and they've forced the rest of the cities and counties throughout the state to apply for reimbursement for expenses at a disproportionately lower amount than the metro area. So those are effectively the two things the emergency declaration does. It gives the county administrator flexibility to be able to respond to needs without having to come to the board for every allocation of resource. And it allows us to pursue state and federal funding for the support of these efforts. It would not change our emergency operations center. We can still do all of those things, but it would have an impact on the speed in which we're able to respond and pursue funding.
And Chair Bowe, I agree with what Mr. Mokrzycki just said. He said everything I would say.
Thank you, because I want to make that clear somewhat, that this is really about our ability to apply for financial reimbursement quickly, which, the state keeps changing the rules constantly on how we can apply for our share of the federal funding. And if you had to wait to the next board meeting and we didn't have one scheduled to make those applications, the way the state keeps changing the rules and changing deadlines, we would probably miss our ability to be reimbursed or be eligible at all for our share of the federal money that should have come directly to the county, which we talked about last week quite a bit, so I won't rehash that now. What I wanted to make clear somewhat is this is, we ran an emergency operations center for, other communicable disease outbreaks in the county without an emergency declaration from the board. And we've responded to other emergencies. But what this allows you to do as the county administrators have flexibility to make those quick applications. And, I do still wonder what end game is and when we can come out of this emergency. And that's probably where you're hearing the frustration from the public. They see us at a point where they think we're now in a good place. As long as people continue, good behaviors and all that stuff, we're not going to see, a significant, imposition on our medical system and our hospital system. We're not going to see, massive changes in rates of death. Probably what we're also seeing conversely, which I still haven't gotten numbers back from public health on, is are we starting to see a decrease in, as I quoted, motor vehicle accident deaths because people are driving less and staying at home. But I just want to make clear for the public, before I support this extension, why I'm supporting it. It's mostly over the changing ground rules that our state government keeps placing on us. If it weren't for that, to me, I think we could continue to do the good work we do without a state of emergency. I think that this continuous state of emergency is fatiguing on the psyche of the public and the people. And the other thing I've asked about is, has there been an increase in suicides and drug overdoses during this pandemic? And I still haven't gotten those statistics back yet either, or domestic violence calls. You know, that's part of this continual emergency that we're creating a psychological scar on our society. So we have to balance that with a continual state of emergency. And is there a real risk? And if it weren't for the fact that we have to constantly change our strategy on trying to keep up with this state and providing our administrator with that flexibility and our staff with that flexibility, I could not support any continuation of this emergency declaration at this time.
Commissioner Sorensen.
Thank you very much. You know, we have a global pandemic at hand that is not just touching the United States, but is now the United States is the leading country in the world for cases. We have no cure, no vaccine. We have hopes that we will get such a thing, but we don't have that. This disease is extremely transmissible. People are still being advised by their physicians to stay home and limit their exposure, particularly their exposure to other people. And I, have been looking at the death data for Oregon, and it is, troubling. We had, 0 deaths as of February 1st. By June 1st, we were just under 200 deaths. By July 1st, we were over 200 deaths. By August 1st, we're at 300 deaths. As of now, we're at about 400 deaths. We're projected, if people follow increased masking and social distancing, we are predicted to have 700 deaths by December 1st. So there is no reduction in cases or deaths overall. There may be variations in weeks, but the deaths are going up in the state of Oregon. And Lane County has been better off than most places in the United States, but that doesn't change the fact that there's a global, national, state, and now local declaration of emergency. So this is not a situation that most of us have encountered in our lives where we are concerned about workplace deaths, or we're concerned about automobile deaths, or we're concerned about suicide or murder or other ways that people die. And I just want to say that this is something that, to quote one of the CDC doctors, this is no joke. This is no joke. People die from this disease. And I really appreciate the fact that our staff has been responsible for our continued low rates of death, transmission, case numbers, and that's the reality. But to say that there's no emergency when we have no idea how long this is really going to go, and certainly the Congress of the United States that doesn't always agree on much, the Congress and the president have appropriated funds for us. The Oregon legislature has appropriated funds. We can argue, quibble, or even demonstrate that we don't think the allocation's fair. I agree with Commissioner Berney that it's outrageous that the cruise industry and the airline industry has received billions of dollars when, as he put it, Main Street has not. And I think that we could certainly use our legislative power to, work with our congressional delegation to try to bring some fairness into the process of the allocation of funding. But to me, there's no doubt that this emergency exists. And I think that we would be turning our backs on our responsibilities if we agreed with people that, for whatever reason, don't think there is an emergency when we are receiving literally daily reports from public health on the status of this global pandemic in our own community. And when it's appropriate, I'll move approval of the order. Is it time?
Any other questions or comments from?
Is it time to move approval, or do you want to just have more continued discussion?
I have asked if there are any further comments or questions for staff first, and then we can.
Okay, very good. Thanks.
Any other comments or questions? I would like to just state, for the benefit of the public out there, our county administrator holds an immense amount of responsibility in our local community fight against COVID-19. He oversees all departments, including our public health, and the emergency board, the emergency action that we're extending. If we didn't do that, would effectively be asking him to fight a global pandemic here locally with his hands tied behind his back. And I know that that is not where we want him to be. We want him to be on the front lines and doing the good work that he's been doing with his staff as he's been fighting this all summer long. I think it's immensely important that we pass this order so that we can keep our numbers low and keep doing a good job here in Lane County. Commissioner Berney.
I concur with you, Chair. I simply want to point out, this is not a forum to talk about our dissatisfaction with state government. I am very dissatisfied in some of those areas, nor is it this a moment to talk about our dissatisfaction with the federal response or lack thereof. All we can do is our best here locally, and all this does is not tie up our administrator and our staff to do their work. Really, there's no big political thing here. So I also will support this, and that's all I wanted to say. Thank you, Chair.
Any other comments? Commissioner Bozievich.
Thank you. I just want to say I disagree somewhat with Mr. Berney's, Vice Chair Berney's comments. The only reason I'm supporting this is my dissatisfaction with the state and their bungling of the handling of Federal CARES Act funding. And if it weren't for the need to provide that flexibility to our administrator to continue to deal with their bungling administration and distribution of funds, and mind you, borrowed federal funds that are placing an enormous debt on future generations, I wouldn't be supporting this motion today. So I am not going to not voice my dissatisfaction with the state's distribution of this and federal government's handling of this. You know, it's why I'm supporting it, is to provide the administrator that flexibility. We have the ability to deal with almost everything dealing with COVID right now without a state of emergency declaration. If the part that makes this declaration important is that flexibility that we're giving our administrator to continue to chase federal funds from the state.
Commissioner Berney.
Commissioner Bozievich knows I greatly respect him. He's taught me a lot. I never once suggested, I would never say you or anyone else can't speak their piece. My point is simple, and that is we should vote on this, we should approve this, we should unleash our administrator's hands, and we should move on.
With that, is there a motion to approve Order 20-09-01-03 as presented?
I move approval of the order as presented.
Second.
Moved by Commissioner Sorensen, second by Commissioner Berney. Any discussion? Okay. Seeing none, we'll call for the vote. All those in favor, please say aye.
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 All those opposed, say nay. Motion passes unanimously. Thank you. We will move on to item C, which is our review of the current open assignments. As you can see, there are plenty. And I thought we could approach this first with and ask if there are any that commissioners would like to remove that feel they're no longer necessary or relevant. So if that is not the case, part of what we need help with on the agenda team is prioritizing some of these. As you can see, there are a good half a dozen or so that continually revolve, and we are getting closer and closer to those resolving themselves. For example, we're moving through some of the code changes, but there are several that aren't assigned a date. And you can see right now on the screen there in the yellow column say to be determined as to follow up. And there are several there, and knowing that our staff is extremely thin right now, some of them have been not as quick to the board as otherwise would be due to our response to COVID-19. But of those, are there ones that we feel need to have a higher priority? And I'm sure each one of us has the ones that we, truly are passionate about. The alternative way to go through this list is, do you want to go through them item by item? I usually expect that everybody has read through the material prior to the meeting date and don't necessarily personally feel that we need to go through item by item. But at the very least, we need to pick and some priority items for staff. And I saw Commissioner Sorensen's hand up first there.
Yeah, I think all the commissioners have either been on the agenda team or are on the agenda team. And so this problem of ongoing tension between the board wanting, and all these items have received at least 3 commissioners that wanted to move it forward. The tension between the board piling on itself or piling on staff for more work, this tension is always there. And I think that it also is a very fact-intensive process to figure out how much work it's going to take and who's doing the work and whether that person has been taken off of that assignment because of COVID or a fire or other more pressing matters. And so I think it's difficult. I won't say it's impossible, but I think it's difficult to do what you are talking about doing, namely marching through this and going, do we really want that or not? I think that I feel very comfortable in having the county administrator and having the county council and department directors and board chair and vice chair just go through this and push things out further and further and leave. And if you have to, put more to be determined dates on items and really focus on what you think needs to be done at the moment. And otherwise, I think that we're just more or less in a popularity contest of each one of the commissioners saying that they like their idea, and I just, to me, it's better to leave it in a setting where the people that are making the decision include more people than just the board, and the county administrator obviously has a huge say in the work of the agenda team and the department directors, who can tell us, particularly in the upcoming legislative session and preparing for the legislative session, what they're really able to get done. So that my comment is, if you have to change the number of assignments and you have to change the to be determined to indicate that really those items are going to be worked on later, if at all. If any commissioner wants to bark or complain, they can certainly do that at the point in our agenda where we talk about assignments. And if the board wants to overrule the agenda team, but realistically, I don't think that's going to happen because the board chair, vice chair, county administrator, county council, board coordinator, department directors are much more informed than the commissioners are about what is going on that we don't see yet until it reaches the point of a board meeting. So that's my suggestion is send it back to the agenda team. And if you have to change those color codes and put more to be determined on lesser important items, then you do that. And I will either live with the consequences or I will bring up something specific in a future meeting.
Commissioner Bozievich and then Commissioner Farr.
Thank you. So I have only 2 out of the 21 items that I initiated and got head nods on to place on the future work items. And I just want to say the one item around private burial grounds was in support of Senator Roeblen, who is retiring from the legislature. And it's really a state issue, and it was about providing support from a local jurisdiction on getting some statutory language written. And I think it's something that is a very low priority legislatively coming into a year where we're going to be fighting about budgets and worrying about changes in unfunded mandates around police uniforms and everything else going on at the legislature. So that one, if you wanted to remove that at this point, I think is able to remove. The other item I have in there is related to the COVID-19 pandemic, and I do believe is part of trying to get to an idea of the balance between the actual emergency and maybe the consequences of continuing some of the controls that are in place in this state, whether we're driving any other issues up by our response. And that I think is something the board needs to have sooner rather than later. I kind of thought it was coming back in 2 or 3 board meetings, and it's been over almost 2 months.
Which one was that, Jay? I'm looking at them.
Almost to the very bottom. There's
it's on the screen right now under 7/21/20 request date.
7/21/20. Yeah. And I thought it was coming back sooner rather than later, and it's been almost a month past when I thought it was coming back. So that one I think is something I just as the only 2 agenda team requests I've made, I'm willing to let one of them go completely because it's more of a state function and a state responsibility. And we were just providing assistance and support to Senator Roeblen. So it could probably be removed from the list. And the other one, though, I do believe relates to the current state of emergency, having a clear understanding of the side effects of the emergency, and also placing into context the current, death rates and understanding of this actual pandemic. So that I do think is still a high priority.
Very good. Thank you for that. So if everybody else agrees for one item removal, that's okay with me. And good to know about the priority level for the second one that I think is the kind of feedback our staff is looking for. Commissioner Farr and then Commissioner Berney.
Thank you, Chair Buck. I'd like to say that I concur with the Commissioner Sorensen's analysis in letting staff and the Chair, Vice Chair make the determination as far as the order of the process. Just want to make a point that I have a single item in the green column is regarding the sheriff's report on the 1033 inventory. The only reason I'm saying anything about it right now is that it will probably be an item on tomorrow's Equity and Access Board meeting. And I'm not going to say anything about it, but later on in this agenda, later on today, I'm going to make a couple of points regarding that specific request. Thank you.
Commissioner Berney.
I also agree with Commissioner Sorensen's remarks regarding his name on here, because he has by far the most work sessions requested. And if he's good with that just getting handled on a priority basis, I am too. I have two items here. One is with Commissioner Sorensen and one is alone. The one alone, which was very clear, it has 3 question marks by it. If you recall, I was going to meet privately with Mr. Mokrahysky and discuss that for clarity and bring it back to ensure that in fact is what the head nods nodded for. We have not done that yet, but we will. And I think the fires in West Lane County right now, forgive the term, but add fuel to the fire as it relates to what I was speaking about. So I think that's in process. It's not going to take much time. It's going to come back to this board before anything is done on it or any work session is scheduled. The other item is my name with Commissioner Sorensen's, and I see that as in process right now. I see that as discussing, the education component of looking at the name of Lane County, and I think that that whole process is coming back, and it will take a little time, and we can talk about what, if any, activities might make sense in that regard, being very understanding of the fact that schools are a cluster of activity right now, and it might be very difficult depending upon timing. So really, I have no problem removing the one with the Commissioner Sorensen and my name on it, and clarifying the only other one with my name on it with the county administrator, and bringing it back to the board.
Okay, so let's go back to Commissioner Farr's item, just to let you know that is scheduled for a follow-up to our board on 10/20 in green. That date just means it's coming up on that board meeting tentatively, unless it gets bumped by something with a higher priority. And so for Commissioner Berney, the one that you just mentioned with your name on it only, that's on the screen, it says 8/25/20. Are you saying that you want to remove that and bring it back to the board later?
Last week, there were several head nods for me to meet with the county administrator, clarify it, which is why the question marks were there, and then bring that clarification back to this board to confirm with the folks that nodded their heads that, yeah, that's what they nodded their heads to, and then move on. So no, I'm not saying to take it off, but I'm saying it's in process, won't take a lot of time.
Okay, just wanted to double check.
Yeah.
Commissioner Sorensen.
Because there are so many of those that are listed with my name, I just thought I'd mention that I do have a priority that, in consultation with the agenda team, when you try to figure out how much of this we can push out or how much of this we can drop off, I just want to mention that 2 things. One is that it is traditional, it doesn't have to occur this way, but it has been traditional for items that don't survive a 2-year term on the list. If they haven't been dealt with, then they are all dropped, and the commissioners in the next ensuing 2-year period will start the process all over. That may not occur this time. It's really up to the board as to whether we do that, but it's not uncommon for items to just be dropped if they've stayed in the yellow too long. The other thing is, of the ones that I've suggested where the board has agreed to hold a work session or make an assignment, the one that I really feel is the strongest, that really only the board can deal with, is the campaign finance reform assignment. Now, I know that's coming up in a couple of weeks for the board, but to me, that's something where the Board of Commissioners can reform now that we've had a Supreme Court ruling in Oregon. That's one that we can really do something in time for the next election cycle that, of course, really begins, the 2-year election cycle really begins on election day. So November 2, 2020 begins the 2-year cycle for the next election. And to me, that would be a really important contribution for this board to make. And it's not something that staff ultimately makes the decision on. It really is a commissioner decision. Obviously, we need assistance from legal counsel, but to me, that is one of the most significant issues facing our community, is the rules by which people raise money, spend money, and get elected to county offices, and it's all within the authority of this board. So if I had to, give my advice today to the agenda team, it would be, let's keep pushing on something that would bring systemic and positive change. And I believe that would be one of them. Thanks.
Chair Bach.
I think you had a date on that particular item you wanted to share.
Yes, Chair Buck, I believe Steve Dingle is on the phone as well, and I think he can address. We did move the campaign refinance item to September 15th for Mr. Dingle to give an update on that item, but I believe he's on the phone right now and he could probably do that.
Yeah, that's right. Thank you. Thank you, Ms. Jones. Yeah, Chair Buck, Commissioner Sorensen. I would suggest that we wait on the campaign finance thing, because what happened is, if you read the Supreme Court opinion, a lot of the key provisions that were under consideration were remanded to the trial court for further findings. So we don't have a definitive answer on whether or not everything that they did is permissible. And so that was going to be my recommendation. And I would urge you to, I can send you a copy of the opinion if you want to review it. And you could give me a call and let me know your thoughts before our agenda team meeting next week.
Mr. Dingle, do you know a timeline for the remand? I know sometimes in the court system it can take forever.
I've actually been in contact with Ms. Madcore, and as you can imagine, given the load that's on the courts right now, I think it's been given a relatively low priority because they're having difficulty meeting the speedy trial requirements for criminal defendants. But I can certainly contact her again and see if she has more recent updates before our agenda team meeting.
Good to know. Are there any other items that commissioners feel particularly are a high priority for them? I know we heard from Commissioner Bozovich and Commissioner Sorensen. Any others that are high priority to you? That will help us as the agenda team to try to move some forward that can be moved forward, maybe in advance of a lower priority item. Okay, I'm not seeing any more. So we've dropped one, and we know who has some high priorities, and it sounds like we'll otherwise take it back to the agenda team and try to prioritize with staff as best as possible, unless somebody heard something different. Okay. Thank you all for your help on that item. And we'll move to county administration announcements. We'll move back to county administration announcements if Mr. Mokrzycki returns. We do have one executive session this morning that we'll do right after we finish this morning's meeting. It shouldn't be too long, but I'll read us into that. We'll give them a minute to return. All right. Well, why don't we then push administrative announcements out to the afternoon? We can come back to that then. And I will read us into our executive session. The Board of County Commissioners will meet in executive session to consider the employment of a public officer, employee, staff member, or individual agent, and to consult with counsel regarding the rights and duties of a public body with regard to current litigation or litigation likely to be filed. The executive session is held pursuant to ORS 192-660, subsection 2, subsection A and H, which allows the Board of Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on any of the deliberations during the executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session. We reserve the right to come back out into public session should the need arise. So why don't we take a short break and we will all dial into the executive session at 10:40. We are currently in recess for the regular Board of County Commissioners meeting. Thank you.